The story of Mercy is a story of barriers overcome and of thresholds crossed. For nearly 200 years, pioneering women and men have led the Mercy Ministry to take on challenges that few others have had the courage to face. And they haven't done it alone. They've always worked with the community, drawing on the talents and support of co-workers and co-ministers. Guiding their success has been a shared vision for the future, a common resolve to change, and an enduring fidelity to the struggle before them. It all began with Catherine McCauley, who in 1827 opened the first House of Mercy in Dublin, Ireland, to educate and support poor women and children.
About 17 years of age, Catherine went into a family that was very poor, and for about 2 years of her life she was subjected to extreme poverty. And when she was about 25 years of age, the Callahans invited her to live with them. In 1823, James Callahan gave his entire inheritance to Catherine.
Catherine was suddenly a rich woman. Rather than indulge herself, she intensified her work for others. Skeptics called the house on Bagot Street Kitty's Folly.
Her brother thought that it was crazy to invest her fortune to build the house for the poor. The community that she built it in wasn't necessarily thrilled that she had built a house to care for the poor in what at that time was sort of the high society of Dublin, Ireland.
When a cholera epidemic ravaged Ireland in 1832, Catherine and the sisters were the only ones to step forward and help the quarantined sick.
Some of the early challenges that the Sisters of Mercy faced were daunting. Catherine had an interest in taking her ministry to the poor, so they walked among the poor of Ireland in their time and became known as the Walking Sisters.
News of their heroic work spread quickly. Formerly dismissive bishops and community leaders urged them to establish missions in their towns and neighborhoods.
And over several years before her death, she established 12 convents in Ireland and in 2 locations in England. And she had plans to go to Nova Scotia at the time of her death in 1841. And in 14 years, she established an enduring ministry that expanded around the world.
I am only afraid, dear sister, that you are not wild enough. It takes considerable life and fun to bear up against such hard work.
These were the words an Irish priest wrote to his sister upon hearing that she had joined the Sisters of Mercy and was moving to America. The United States at the time was described as a rough and sprawling void. It was full of growth, opportunity, and need, a perfect fit for the Walking Sisters.
I'm sure they were scared to death, but they were willing to respond to the call to serve. No distinction of who they would serve or how they would serve them, and they went in the most difficult situations.
In St. Louis, 6 Sisters of Mercy crossed the Mississippi. A month before, they had been ministering in New York, and now they were venturing into the Wild West.
The day they came, they started a school. Within that time, they were visiting the sick in their homes. They immediately started weekend classes for black women. Then they said there's a need for health care, so they gave up part of the convent and they slept on the floor.
Absolutely amazing women to do that. Probably the biggest risk takers in the church. You know, often as they would go into these mining towns and trading communities, they'd be the first signs of civilization. They absolutely believed that they would pray every day like it all depended on God, but they would work every day like it all depended on them. They spent a lot of time listening to everyone in the community. You know, they didn't go there and say, well, we're going to build a hospital or we're going to open a school. They went there and listened to the community and heard what they needed.
And they met with a lot of hostility, bigotry, hatred, misunderstanding, but they never returned that. They're women that gave all. And in that process, they gave life and hope to others as well.
They were as essential and flexible as they were fearless. As 2 sisters bound for Los Angeles stopped their carriage outside the small frontier town of Fort Scott, Kansas, They were greeted by a priest who extolled Midwestern weather as better than California. The sisters changed their plans and opened the first hospital the town had seen in 30 years. In the resort town of Hot Springs, Arkansas, two sisters arrived with $1 between them. With hard work and sensitivity to the needs of the community, they transformed a small house into a 30-bed hospital and began formalized health care in the area. After praying for their safety aboard a stagecoach rumbling down an old Indian trail, Sisters of Mercy arrived in Springfield, Missouri. Their destination? An 8-room building that would become both hospital and home. 8 years later, two sisters quarantined themselves in camps outside Springfield with smallpox victims.
They would have requests to go to different locations, and more often than not, they honored those requests by sending sisters out to form new ministries, whether it be schools or healthcare facilities.
As they crossed into the 20th century, the sisters continued to cross thresholds. Their decades-old vision of providing formal health care to the people of Fort Smith was realized through the 30-bed St. Edward Infirmary. When the brother of one of the Sisters of Mercy pleaded for help for his town's hospital, the Sisters of Mercy faced the bitter cold of Independence, Kansas, to spread their ministry. And after purchasing what was then called Oklahoma City General, the sisters integrated the hospital, decades before desegregation became law. In the mid-1970s, the Mercy mission extended into Washington, Missouri, when St. Francis Hospital joined with Mercy in St. Louis.
It's our fidelity to the struggle. Our eye has to be on fidelity. Who do we say we are as Mercy women? Who do we say we are as Mercy co-workers? Who do we say we are in our mission statement? Like the sisters before us, we're going to bring to life the ministry of Jesus. How? Compassionate care and exceptional service.
Increasingly, fulfilling their mission required a more systematic and coordinated approach. On July 1st, 1986, the Sisters of Mercy Health System was formed. With Sister Mary Rock Rockledge serving as the first health system president and CEO, Mercy entered the modern era with both vigor and flexibility. Lay leadership was cultivated and became increasingly vital. Each leader was chosen for embodying the innovative and compassionate spirit of the sisters.
I got teased unmercifully. I was joining a nunnery.
The health system was well positioned for the rapid changes in healthcare and for continuing the ministry. In the final decade of the 20th century, new thresholds were being crossed with breathtaking speed. And in the last 10 years, Mercy has responded to the changing healthcare climate with several bold innovations. One of the most effective has been the creation of the Resource Optimization and Innovation Operating Division.
It's basically the supply chain division for the Sisters of Mercy Health System. The offering includes the combination of contracting with distribution, with manufacturing, and consulting resources. We bring that together to render a solution that's more integrated than most in the industry today.
In 2009, ROI was named the second best healthcare supply chain system in the world, behind only Johnson & Johnson. While Mercy has saved costs, they have also invested in technology and safety. Introduced in 2003, Mercy Med's barcoding practices and bedside scanning systems verify drug compatibilities, timing, and correct dosages, and have reduced the time required to administer medication by 33%. In 2006, Mercy instituted SafeWatch, now the nation's largest single-hub remote intensive care unit, which monitors critical care patients from one location around the clock and helps bedside caregivers take early corrective action. As a result, ICU length of stay and ventilator days have decreased. Mercy had a vision of one electronic health record system, before the idea was mainstream, to allow Mercy to treat patients better together while improving safety and productivity.
The electronic health record for Mercy was probably one of the biggest projects they've taken on, at least during the time that I've been here. And electronic health record was our project to put together a one patient, one record so that we could tie together all the clinical information either in the inpatient and the ambulatory world.
In the process, nearly 23,000 physicians and co-workers were trained. Mercy's epic teams, traveling from location to location to ready them to go live, became well acquainted with fellow co-workers across Mercy. In fact, Mercy is among only 3% of healthcare organizations in the country to be recognized for the comprehensive implementation of electronic health records, putting us in the ranks of such institutions as Johns Hopkins and the Mayo Clinic.
We're pioneering a new model of care, and that's a phrase that we've been using more recently, but if you look back on our history, it's an attitude that we've had for almost 2 decades now. We've invested significantly since the early 90s in our physician relationships. We've invested significantly in our technology infrastructure.
And Mercy is actively preparing for the future of healthcare with such initiatives as the Physician Group Practice Demonstration Project. As one of 9 groups chosen nationwide to find ways to control cost, Mercy's PGP project is demonstrating how processes can be used to promote and support the delivery of excellent, affordable health care.
When people say we do high quality care here and someone else asks you, prove it, that's a different game. Now we have the capability, and we'll have across all Mercy, to prove it.
Building on these successes, Mercy crossed another technology threshold by creating an online connection between patients and their doctors with My Mercy.
My Mercy as a patient portal allows the patient to have increased access to their physician. It allows the physician to be able to communicate in a much stronger fashion, in a much more real-time fashion with the patient, and pretty much tightens that relationship between the patient and their physician.
My Mercy has opened up unlimited possibilities in managing health. With the right information and a convenient connection to their doctor, people can make smarter decisions and live more productive lives.
I think our patients are getting very excited about what they see Mercy doing today. My Mercy is a great example of that.
Throughout our history, Mercy has taken the lead rather than waiting to be pushed. We've redrawn frontiers, crossed into new thresholds, and stayed faithful to our mission to serve. As we step into the second decade of the 21st century, we find ourselves in a similar position to Catherine McAuley almost 200 years ago, in a position to lead, yet facing important decisions. We are poised once again to transform healthcare. The thresholds we are called to cross are now more cultural than physical. We already have the tools and technology for the journey.
Mercy Health System is breaking away from the herd. They're doing it in an innovative fashion. They're doing it in a very patient-centered fashion. And it's because they see that healthcare can be better.
Today, our journey continues with a ministry entrusted to us by the Sisters of Mercy. We are called by Mercy to step forward, to lead, to innovate, to make a difference, to care, to heal.
We are the people of Mercy Health Ministry.
Together, we will pioneer a new model of care.
We will relentlessly pursue our goal to get healthcare right, everywhere and every way that Mercy serves.
We will deliver a transformative health experience.